Hi, it's Joey Remini here from seekingbalance.com.au. I'm a vestibular audiologist and neuroplasticity therapist. I'm the founder and director of Seeking Balance International. And today I'm excited to talk about persistent postural perceptual dizziness, also known as PPPD, because it really is a fascinating condition. And I suppose the first thing I want to say about PPPD is that it's all reversible. You can actually genuinely heal and recover from this condition. I'm going to explain a little bit about what this condition is, how people come to get it, and it's a new diagnosis, so not all doctors know about it, and it could be that you're listening to this and thinking, oh, well, maybe this is me, but my doctors haven't had the language yet or the capacity to diagnose it. So basically, PPPD, persistent postural perceptual dizziness, is a condition where there's persistent sensations of dizziness. This can be inside the head or the body, and it can be described as rocking, swaying, unsteadiness, or uneasiness. And it lasts for longer than 3 months, and people report it being present at least 50% of the time. So it's not just when you move your head, such as positional vertigo. It's persistent postural perceptual constant dizziness. It's not classic vertigo with nystagmus eye flickering either, but rather this dizziness can be described as in the head or even in the whole body. People often report sensitivity to visual stimuli such as crowds or computer screens, and it may be worse for them when standing or sitting upright, and it can be exacerbated by head movements, but it's not only exacerbated by head movements, and really this is characterized by dizziness that occurs even when you're still. PPPD is often non-responsive to physiotherapy or generic treatment for vertigo. It may be preceded by an acute vestibular incident such as benign paroxysmal positional vertigo or an ear infection or even Meniere's, but not always. So sometimes PPPD does spontaneously arise with absolutely no indication of prior inner ear injury. PPPD clients express a debilitating concern and a strong self-judgment toward any dizziness or not quite right sensations that they feel. So PPPD, it's a form of chronic dizziness that is not explained by injury to the inner ears. So with this condition, all medical test results can actually be normal. This can feel extremely frustrating when if you yourself, you're feeling abnormal, but it's not explained in any way through the investigation process, which can be very exhausting and very expensive. Many people are told misleading comments from health professionals, such as it's all in your head. Now, this is a complex condition, and a simple statement like that is simply not going to help anyone to heal. And, it's not really covering the full story. For PPPD, there is no evidence of any physical damage to the brain or the inner ear. So the diagnostic process that your doctors are taking you through is one of ruling out other conditions. Doctors will first investigate for Meniere's, ear infections, migraines, or BPPV, etc. In many cases, PPPD is triggered by an initial incident of true vertigo. Now, this could be your BPPV or your Meniere's or your ear infection. However, once this initial vertigo has resolved, there's this persistent dizziness that remains. So it's thought that the brain filters can't reset and return to normal after that initial vestibular shock. People with this condition describe their symptoms as persistent and present at least 50% of the time, or constant with 24/7 dizziness. It is upsetting for them and they feel uncomfortable on a daily basis. Some people will begin to avoid daily activities such as driving or housework because they feel so unsafe inside of their own body. This truly is an invisible and debilitating condition if it goes unrecognized or undiagnosed. I have met many clients who have felt that they were going crazy and that nobody could describe or explain their condition to them. And unfortunately, this is actually very common for anyone with PPPD. Often they will have been to see well over 15 doctors and they're lost, they're confused, and they're really exhausted. The PPPD form of dizziness may temporarily disappear while performing an engaging task or becoming focused elsewhere. However, when returning back to normal tasks or stillness, this persistent dizzy sensation can return. So while there could appear to be some temporary relief, it often will just come back in daily life. And this phenomena is described as being context dependent. So it depends on what you're doing or where you are as to how present your symptoms are. The dizziness is like a constant background fuzz that when noticed is ever present and distressing. At worst, it can lead to avoidance behaviors, isolation, and an ongoing cycle of maladaptive behaviors that reinforce the dizziness. This condition and its diagnostic process can feel debilitating, frustrating, and disappointing. Clients often report waking up in the morning with dread, asking themselves, is the dizziness still there? Has it gone yet? Am I still dizzy today? They describe living in fear of their symptoms and feelings of being a failure. Why aren't I better? How come other people can recover but I can't? The doctors and physiotherapists said I should be better by now. I should be over it. What is wrong with me? These thoughts reflect a belief as though they have somehow failed at being normal. And this is, of course, untrue and a total misunderstanding. Triple PD is, in fact, a series of normal misunderstandings between the eyes, spinal cord, ears, and brain. The signals have been misled and misfired, and all of this is reversible. For this condition, there is a strong link with anxiety and a subconscious underlying fear of the dizziness itself. The body's sensations are perceived with a fright. The brain then responds with its normal and natural anxiety response, exacerbating symptoms, resulting in a loop of feeling dizzy, anxious, dizzy. The fear of dizziness and associated anxiety is quite natural and not a psychiatric condition. Almost everyone who feels dizzy experiences the associated shock and anxiety that comes with it. It is appropriate anxiety within the circumstances. However, if left unmanaged, this chronic anxiety can delay the natural recovery process, as chronic anxiety inhibits neuroplasticity. Neuroplasticity is your brain's ability to change itself. Your brain and your body's ability to change itself. Over time, it can lead to increased anxiety and avoidance behaviors that perpetuate the triple PD condition. So this is where the anxiety, the isolation, the avoidance behaviors are all really feeding into the condition and strengthening the dizziness, unfortunately. Now, this is all to be accepted if you don't have any other skills, tools, or resources to teach you anything else to do. So let's look at what we can do about it. For some of you who are reading this or listening to this, you might be thinking, oh, this is me and this is what I feel. Sometimes gaining this knowledge alone and understanding your body and learning about triple PD as a diagnosis can be very useful for helping you to move toward your healing. Sometimes, unfortunately, we are handicapped by the diagnostic search for understanding and validation. This can impede us from actually starting our daily neuroplasticity practice. So I urge you to get the best diagnosis you can, get medical clearance, and start to focus on your daily program. Start healing, start retraining your brain to feel normal again. You will simply need to learn how to self-soothe the natural anxiety mechanisms and use neuroplasticity daily to reset your normal sensations. Nobody else can do this for you. It is likely that you have some strong belief systems that are subconsciously impacting your neural settings, and these will need to be updated too. Your old beliefs can keep you stuck in the triple PD cycle of isolation, avoidance behaviors, and anxiety. The emotional and spiritual layers of healing are essential for preventing relapse of triple PD. By spiritual, in this case, I refer to your capacity to believe in yourself and to have faith in your body. This is not at all related to religion. Many clients are prescribed medications for depression and anxiety during the diagnosis process. Some people never receive a diagnosis at all, and it's important that you listen to your body and work with medical professionals who you trust. You need to feel safe and able to move on from your uncertainty. If you are always chasing a diagnosis, you may never heal. In order to heal, you need medical clearance, not an exact understanding of your symptoms or your diagnosis. For some people, they never fully understand their diagnosis or their symptoms, but they still learn how to heal it. How do I know? Because I've seen it. I've really gone through this process so many times with so many people. In summary, people with triple PD, persistent postural perceptual dizziness, are feeling dizziness sensations that may have started spontaneously with an ear example, for example, with an ear infection, I should say. But the dizziness never resolves. This creates a normal emotional response of anxiety that impedes the neural repair process. So the initial dizziness resolves, let's say the ear infection itself heals, but the remaining neural signals for dizziness sensations continue to fire throughout the brain and body. This results in persistent postural perceptual dizziness. The more we focus upon these sensations, the more the brain refires them. So if we were to wake up each day and think, am I dizzy? Is the dizziness still there? Has it gone yet? Will I be able to drive today? For example. By doing that, we are further stimulating the distress associated with the dizziness neural pathways in our brain and body. Thus, throughout the day, the brain is putting a large amount of attention upon the dizzy circuits, and it is being placed in the front of our attention so that it is in effect perceived as always there. Despite normal test results, the dizziness is there inside the brain, firing along healthy neural pathways. It is a neural dizziness rather than an inner ear injury. It is like error signals or mistakes occurring within the neural templates of the brain. Wherever we focus, we fire neurons. We look for dizziness and we can find it. This is because the mapping of that sensation lives in our brain and we can activate it at any time. Similar to being in a dark room full of objects, we can only see whatever it is that we shine the torchlight upon, but it's always there. Because if it is in the darkness, we don't notice it, but if we shine the torch on it, then suddenly we see it. Our attention becomes the source of our struggles and our solutions. For triple PD, our attention is like that torch, shining our attention on the dizziness and keeping it at the front of our awareness. The dizziness signals are there in the background, bouncing around your brain, ears, eyes, and spinal cord. You don't need to get rid of them, and you don't need to cure it. These are useless and harmless neural signals. A different way toward healing is to build stronger neural pathways that feel normal to you. For example, you could learn how to put your attention and focus upon your desire to feel calm, steady, or at ease. You can do this while feeling dizzy, as these pathways are adjacent and can co-occur. Eventually, the stronger pathways will override the dizzy ones so that you no longer notice them even being there. Your brain will learn that the dizziness signals are not important, they're not dangerous, and they will become filtered out of your awareness as effectively boring, useless, and unhelpful. My clients who learn to do this incrementally notice that their dizzy signals become weaker and weaker. They become stronger and stronger. They return to normal and they literally regain their steadiness. People with triple PD often feel that they're going crazy because their symptoms are not validated by medical testing. They often report that they feel that others don't believe them. These clients can end up with a referral to see psychiatrists or psychologists, and they may be medicated with anti-anxiety or antidepressant medications to help numb the unwanted distress or panic that is literally within them daily. Please note that triple PD is not a psychiatric condition. As with any condition, however, triple PD can co-occur alongside any other diagnosis. So this is known as a comorbidity and can further complicate the investigation process. In other words, a diagnosis of anxiety or depression is absolutely not going to replace in any way, shape, or form treatment and diagnosis of triple PD. It's important not to confuse them. Anyone with persistent dizziness is likely to experience a normal reaction of anxiety or feelings of depression. This is all understandable and it is not abnormal. People with triple PD can become stuck in a cycle of worrying about dizziness, focusing upon dizziness, being anxious about dizziness, and then refiring the neural pathways creating the dizziness. This is the maladaptive cycle I referred to earlier. The best way to heal this form of dizziness is to learn about how to break your cycle of worry by addressing your beliefs. You need to go deep into your inner world and shine a light on your personal belief system. There are many skills and tools you can use to help you do this. You can learn to trust your body again by practicing the body scan, and you can get access to that in the free starter kit, or of course through the Rocksteady program. By practicing the body scan with curiosity to what you feel is a good way to start. Consciously focus on the areas of your body that feel at ease. The body needs to learn how to feel safe and steady again. And this is not something that your logical brain can fix. And it's not something that doctors or therapists can do for you. You can't even tell yourself, I'm safe, get over it, blah, blah, blah. You can't talk yourself out of this because the anxiety parts of your brain do not work in logic. And of course, they don't speak English. The steady neural pathways that you have inside of you, inside of your brain, can be activated by feeling them and focusing upon them. This is a very, very important skill that can be learnt at home. The Rocksteady Module 1 exercises begin here and guide you through this process. You can try the exercises in your Rocksteady program. any of them and all of them. It is recommended that you start with simple standing, sitting, or lying exercises using wall and floor supports. Do not focus upon dizziness or ask yourself, is it there? Is it still there? Etc. Instead, you are now focused upon feeling your center and finding steadiness. Give yourself a totally new point of focus. Make your brain work hard to achieve this focus. Your brain needs a new job. Your brain will then become occupied with the neural pathways that represent steadiness. This will become your felt experience. In other words, you can retrain yourself to feel steady. You literally learn to feel steady again and to strengthen those neural pathways within your body and your brain by practicing it on your own. You can close your eyes in any position and try it now. Practice finding steadiness sensations in your body. Feel steady so that you can rebuild more steady neural pathways. What can you do and how can you heal PPPD? Well, firstly, be gentle. Be so gentle with yourself. This has been a long process of diagnosis and you are most likely exhausted. Give yourself lots of rest. Get support. Take time to learn about healing with neuroplasticity. Remove any guilt or shame you are feeling about PPPD. This is not your fault. You have done your best. You are normal despite having this diagnosis, or not having a diagnosis, but suspecting this might be you. At the end of the day, you are you. Healing is a process that you cannot force or push through. You need to be patient and you need to invest time into this. Try the standing scan or the sitting scan in the free starter kit, or use the full Rocksteady program to guide you through this healing. As you do your sitting or standing scan, remind yourself that of course the dizziness signals are still there in the background. You don't need to look for them or focus upon them. They are there and that is not going to help you or hurt you. Leave them be. The dizziness sensations are strong neural circuits that are firing throughout your brain and body. And if you've had this condition for a long time, they are going to be very strong neural settings, very strong neural templates, and they will fire rapidly and easily. So you don't need to focus on them or strengthen them anymore. They're strong enough. But I want you to know they are real and you are not imagining them. It is normal to be afraid of dizziness and you don't need to judge yourself and you don't need to get rid of it. Instead, shift your focus to your touch sensations in your skin. Feel the floor, feel your clothing, or feel the wall if you're touching it. Stand with your feet wide and hands on your hips if that assists you to cultivate steadiness. Find it, feel it. Focus on your real felt sense of steadiness. Use your touch system in your skin. All of these steady signals live inside of you too. Even if you have dizziness, the steadiness is beside the dizziness. They're both there. Focus on the steadiness. Steadiness is an antidote to the dizzy sensation. Practice utilizing your touch system so that you can literally feel your steadiness and safety in your skin. Acknowledge the dizziness signals are in the background, they're in your mind, and allow it to dissolve out of your awareness. When we remove our focus from the dizziness, it becomes less important and has less neural firing. We want to now redistribute your attention, brain flow, and focus toward your hidden physical and emotional sensations of steadiness. You can do this by shifting your focus to feel it in your skin. Your steadiness is already there beside the dizzy signals. You don't need to work hard for it, but you do need to find it. Keep looking for steadiness sensations until you find them. You create these sensations in your body and your mind. As your steadiness neurons fire together, the steadiness neural pathways become stronger. As you do this more often, it becomes easier and more normalized so that you can feel steady 24/7 instead of dizzy 24/7. And now you can see why self-belief is so essential. If you don't believe in your body or your ability to practice finding steadiness, it is unlikely you ever will. Ask yourself, do I believe that I can retrain my brain? If you think, why didn't I learn this years ago? It seems so simple. Remind yourself that these skills take time and professional guidance. If someone could have taught you this, they would have. Our knowledge and understanding of the mind-body connection has evolved over the years, and many of your doctors and health professionals will not have had any training in this healing process. I know many clients who had doctors say to them, just don't worry about it. But what the doctors didn't know is how to teach people to implement that advice. Rewiring your neural pathways is something that you have to learn to do within yourself. And you may need a mentor, you may need a teacher, you may need therapy, but either way, you still have to do it within yourself. The teacher or therapist can't do it for you. Reading this article will not create neural patterns for you, but by practicing the exercises that you read and feeling your body with openness, you will begin to fire neurons differently. It's all about the practice. When you feel your body without fear or judgment, you can create new pathways. You can choose where you focus, you can think clearly, you can think how you speak to yourself. You can treat yourself with kindness. You are in control of your choices and your focus. This self-study process gives you more and more capacity to choose feeling normal again. Until you learn how to do that, the option never exists. I want you to keep going. Believe in yourself. If you tell yourself that you can't feel anything or you can't find steadiness, well, you know what? You won't. You simply will not start a daily practice and you will never discover these feelings of steadiness that are inside of you. You are powerful and your mindset is powerful. Speak to yourself with kindness and be open-minded as you try new things. Be patient. Feel your way from your feet up. Nobody else can do it for you. Only you can change your neural templates, and you can do this whenever you feel ready. Now, here's a little hot tip for you. Most dizzy sensations, but not all of them, are located in the head where we have so many bouncing neurons and emotional centers. It can feel overwhelming or distracting to focus on what you feel in the upper parts of your body, especially when you're first learning. Many people also feel strain or symptomatic around and behind the eyes. So to start with, try really bringing your focus to the lower parts of your body, to your feet, legs, and hips. Feel your skin and muscles. Cultivate connection to your legs, to your feet. Feel the chair, feel the ground. Reconnect to your lower body and help get your attention away from the dizziness of the head, because that's where there's been too much overemphasized attention while you've had this condition. Get back into your body. Start with your feet. Take your time. Always stay safe. If any of this exacerbates feelings of anxiety for you as you practice alone at home, you might want to consider getting private therapy so that you can be supported through this learning process. You don't have to do it alone, and it's not your fault. It just is. Find someone to help you rewire your neural pathways and use the Rocksteady program to offer you extra self-study guidance if you feel stuck. I highly recommend you go through the 6 modules step by step of the Rocksteady program. I want to finish off with the PPPD recovery case study. So the vast majority of my private clients have PPPD. Their symptoms may have started with PPPD, vestibular migraine, mild debarkment, or Meniere's, etc. But for whatever reason, it evolved into persistent postural perceptual dizziness. Between their vertigo episodes, they report feeling constant rocking, pushing, pulling, any form of dizziness. These clients have often tried everything from everyone to help them feel better. They have seen multiple doctors, specialists, natural therapists, alternative health options, and spiritual healers. They've tried it all, but then they find me on YouTube, or they're referred in. The process of healing that I take them through gives them their power back. I teach my clients how to listen to their body and how to respond to the changing needs of their body, mind, and soul, not only each day, but each moment. I give them skills that they can practice dynamically in their daily life. In this process, I strongly urge my clients to stop looking outside of themselves for solutions, because their symptoms are not something that any other person can resolve. I want to talk you through a recovery case study with Ellen. So when Ellen first met me, she was a little short. She was skeptical that what I offered would work, and she openly said, "Joey, I've lost faith in doctors. I've lost faith in natural therapists." And you know what? I validated her fears and I said, "I can't get rid of your symptoms. That's physically impossible, and I understand the science enough to know that. But what I can do is I can teach you how to feel normal in your body again using neuroplasticity." I told her, I can teach you how to rewire your brain and body. And Ellen said, "All right, I'm willing to give it a go." She was willing to start a daily practice. She was willing to feel her sensations, which is very important. She was willing to feel her emotions. She was willing to ask for support. She was willing to take on a 6-month commitment doing the Beautiful Balance and Rocksteady program with intensive private therapy support. Ellen couldn't drive anymore, but she wanted to. She loved animals and she wanted to be able to take care of them without fear of her dizziness preventing her from doing more strenuous farm work or chores. She wanted to travel again and dreamed of going overseas on adventures in Europe with her husband. Ellen hated what she felt in her body and she was both depressed and anxious about it, but seeing a psychologist hadn't helped her. Medication hadn't helped either. She was at her wit's end and not yet ready to give in. Once Ellen established her dreams, her goals, her values, her inspirations, and her desired feelings, we could quite simply create a daily practice for her to get started. She committed 15 minutes a day to her practice, her personal customized practice, searching for her desired feelings and cultivating the neural pathways that she wanted to feel. She put in 15 minutes a day. She got better with practice and she began to actually feel better. I gave her skills and tools for working with her persistent doubts and sabotaging thoughts. She did written exercises to identify her fears and limiting beliefs, and she began to overcome them. She learned about her balance system, her mind, and her emotions. She started to implement neuroplasticity. Ellen developed trust in herself and built confidence in her capacity to heal by building non-judgmental skills, self-awareness, curiosity, and by literally feeling her progress. After 3 months of private therapy, her dizziness had resolved. She no longer had constant rocking sensations. She felt steady and tall in her body. She had faith in herself again, and she had stopped looking for external fixes or cures. She was driving again and tending to her animals on the farm after years of being too afraid. It had been over 10 years of living with PPPD. Ellen was starting to choose new activities each week that she could add to her I can do this list. She was getting more and more of her life back. With time, Ellen could do everything she wanted to do. She'd returned to normal and booked a holiday. She now understood her fears, her panic, her avoidance, her anxiety, and her solutions to overcome it all. She had figured it out by listening to her body. She had reset her vestibular system, and she now had excellent proprioceptive touch function to help her feel at ease in daily life. Ellen took her power back, and I encouraged her to set boundaries for herself, physically, mentally, emotionally, and spiritually, so that she can prevent relapse. Ellen used the Rocksteady process, the self-study program, to heal her PPPD, which she no longer has. So if you're seeking support for your recovery, you can certainly book an initial consultation to talk with me. I'm happy to support you. Or you can go to seekingbalance.com.au and get started with the self-study program right away. This is a condition that you can reverse. You can retrain your brain. You can reset the neural communications from your inner ears, eyes, spinal column, midbrain, brainstem, and beyond. And I think the number one most important thing is that you have medical clearance, so you don't have to worry about anything sinister, any underlying condition. Once you've got medical clearance and the doctors have said, look, there's nothing more we can do, get into healing. This is where you are the expert. The doctor cannot do the healing for you. The Rocksteady program will guide you through that so you can quite seriously become the expert in your own healing process. So I'm Joey Remini from seekingbalance.com.au. PPPD, Persistent Postural Perceptual Dizziness, is a debilitating and invisible condition that you can heal and recover with a daily program. I recommend that you start with at least 15 minutes a day with physical, mental, emotional, and spiritual aspects to address all parts of you and all the parts of your brain that need to be reset and rewired. So all the best with your recovery. Please reach out if you need support. Bye for now.